Now, to go in depth on this health care ruling, we are turning to, say, an expert in the field tonight.
That's right. We have with us attorney Doug Griswold from Chambliss in Chattanooga. He is an attorney specializing in corporate and healthcare law. And Doug,
now we understand that you've been glazing over this issue and this decision all day. So thanks so much for joining us. Our first question tonight, getting to the heart of the matter, if you will, what does today's decision really mean to our viewers, people like working families in the Tennessee Valley?
That's a great question. I think for those families who already have health insurance, there probably won't be any real significant changes coming out of today's decision. I mean, those families will most likely still be able to keep the coverage they have, and some of the benefits that have already been enacted as part of the legislation. For example, the expansion of care to individuals under the age of 26. Well, those are still as part of the law. The question will be going forward what that does to their premiums, and I think that's something that we really won't know until as things develop down the road. With respect to families who are not covered, well, that's obviously the bigger issue. They're going to really be faced with a cost-benefit analysis of, does it make sense to go out and obtain insurance, maybe through these new health exchanges that have been enacted as part of the law, or do they go ahead and forego buying insurance and go ahead and pay the tax? So.
Now, I have a question about the individual mandate. How can this be enforced with people who don't have insurance? I mean, really, and then we're hearing that Tennessee could lose out on some Medicaid funding if they choose to opt out of health care. Is that true?
No. In the sense of if Tennessee does not decide to expand Medicaid as is permitted under the new law, they will not be, any existing funding will not be subject to being pulled. However, they will not be entitled to receive any additional funds unless they decide to expand Medicaid as, again, the law requires. So.
Okay, so let's maybe talk about cost.
Sure,
a huge issue, of course.
Sure.
How much is this going to cost taxpayers?
Well, in terms of, I guess, the direct costs, it really will affect those individuals who decide not to buy insurance. For those individuals, they'll be subject to a tax beginning in 2014. The cost for individuals will be either $95 or 1% of their adjusted gross income, and for families it will be $285 or again, 1% of their adjusted, or the greater of, I'm sorry, I should say. So, for example, a family that makes $40,000 per year, you're talking about a tax of $400.
All right. Well, I'm sure you'll be digging through some paperwork and trying to figure out exactly, what this means for everyone. So we really appreciate you being here with us this evening. Of course, we could talk forever, but we've run out of time. So thanks again.
Thank you.